Cities at 11. Time now for a pandemic perspective. We've seen a lot of new developments surrounding the coronavirus pandemic recently, so we wanted to get a pulse from our local health leaders. Joining me now is Janet Hill, the Chief Operating Officer for Rock Island County Health Department. Janet, thank you so much for joining us this morning. We want to dive right in. Give us a pulse. Where is Rock Island County right now in the fight against COVID-19?
We've seen rapidly rising cases since Thanksgiving. We're seeing more than 200 cases a day reported from labs, and all those home tests that people are buying aren't included in the official case count, which means actually the prevalence of disease is larger than what our official case count shows.
And the Illinois Department of Public Health had taken over contact tracing, which kind of goes in line with the reported number of cases because people are getting those at-home tests. So yesterday we were made aware of at least one instance, though, where a mom in our county said that her daughter tested positive at an official site. It still hasn't been contacted by the state. So could you walk us through what the state's process is for contact tracing?
Sure. So last week there were more than 207,000 cases in the state of Illinois. And so the IDPH Surge Center was meant to help local health departments all across the state get information out as quickly and easily as possible to positive patients. As you can imagine, when you have 207,000 cases hitting within a week, not everyone will be called. So the goal of the center is to get information to people as quickly as possible. However, that information is widely available. So if you don't get a call, please do continue to follow isolation and quarantine rules for the health of our entire community. And if you need a refresher on those rules, they're available on our website, our Facebook page, the state and federal websites and social media channels, and then many of our traditional media partners have been reporting them also. As a reminder, you are to isolate for 5 days after a positive test or the onset of symptoms, regardless of vaccination status. And you can leave isolation after day 5 if you have not had a fever for 24 hours and you're getting better. And just day 0 is the day that you feel sick or you test positive. And if you are a close contact of someone and are not feeling ill, you do not need to quarantine.
Well, and this week, the Biden administration made at-home COVID-19 tests available to be ordered by Americans online. But this means when people do test positive, we're really relying on the public to self-disclose that they've tested positive. You know, in Henry County, they have the way that a website you can go on and you can self-disclose when you are positive. Rock Island County doesn't have that. So could we see a false sense of decreased cases in the county and ultimately across the nation when when this happens, providing kind of a false sense of security?
I think that's possible. So, which is why we are starting to look more at hospitalizations, which are still very high in our community. They're not quite as high as they were right after the Christmas holidays. However, that doesn't necessarily mean that people were discharged. Many of those patients have died. So far this week, we've had 14 deaths, and deaths are a lagging factor in the COVID-19 as a COVID-19 indicator. They happen several weeks after a spike and after a lot of suffering and use of hospital resources.
You've been working on these front lines throughout the whole pandemic, working so much overtime. What is going through your mind right now when we see all these changes?
I think that we are coming to a point where we are learning to live with the pandemic a little bit more as routine, and that's why it's really important for people to stay up to date on the isolation and quarantine and masking guidance. There's been a lot of changes in the last few weeks, and we hope that people are paying attention, and then not only paying attention but following through with their actions.
Yeah, and one of those changes you had mentioned, the CDC last week updated their mask guidance saying that we should be using the N95 and KN95 masks over some cloth masks, but then later came out and said that 60% of KN95 masks in our country are fake. But these are the same masks that we've been told from the beginning that these were what was keeping us safe. So how do we gain the trust of those skeptics who are seeing the same changes and same back and forth that you are seeing?
Sure. So information changes during a pandemic because we learn more about the virus and how it's transmitted. So information that you may have heard, coming up on 2 years ago probably is outdated. What we do know is that cloth masks are better than no mask, and the best mask is the one that you will wear every time. Make sure it fits tightly around your face and your nose. Surgical masks are widely available and they weren't in the past. And when you couple those with cloth masks, that offers really good protection. The CDC does say that the N95 and the KN95 should be worn in crowded public places. Those are becoming more available. The ones that are labeled surgical should be set aside for healthcare providers, though they still are in the trenches dealing with dozens and dozens of patients who are infected in our hospitals.
Janet Hill from the Rock Island County Health Department, thank you so much for joining us this morning. And
You're
if you
welcome.
or someone you know is looking for a COVID-19 vaccine, we have compiled all that information you need so you can get one. All you have to do is text the one-word vaccine to the number on your screen. That's 309-304-0888. Again, you have to text that number, don't call it. Well, still ahead.